Returning now to one of our top stories, the growing salmonella outbreak linked to pistachios. Health Canada says more than 50 people are sick, 9 are in hospital after eating various brands of pistachios and products that contain pistachios, like the popular Dubai chocolate bars. The contaminated products were distributed in Ontario and Quebec under the brand names Habibi, Al Mukhtar Food Center, and Dubai. Joining us now to take a closer look at this is Dr. Paul Roumeliotis, the Medical Officer of Health and CEO of the Eastern Ontario Health Unit. Thank you for being with us, Dr. Paul.
No problem, Stefan. My pleasure.
What do you make of this outbreak? Do you expect that it will expand or we'll see more people come forward as being sick?
I think that, now they've raised the alarm. So I think, moving forward, people are going to be more vigilant and checking the products. But I can't see that other cases won't arise, because apparently this has been going on for a couple of months now, Stefan. And so I think that there might be some more cases, but I think the bottom line is that, be wary about it now. Now that we know that it's out like that, you get rid of those pistachios, check them, go to the Health Canada website, and you'll see basically the product numbers. And so you can either throw them away or go back to the retailer where you bought them, but just be quite careful about that. And the other thing too, Stefan, is probably the number of 59 total is probably an underestimation, because this is people that got sick enough to go and get tested, and then it was tested positive for salmonella. So I believe that there are probably more cases out there that did not go seek medical attention and were not tested. So that's what we're seeing now. But the bottom line is that now that we know that the information is out, please be aware about what you're eating in terms of those recalled products that you mentioned, Stefan.
And that being said, when we talk about salmonella, we hear about cases of recall quite often. And you said these are people that would have been sick enough to go in and get tested. What are the symptoms that we're watching out for, or maybe some scenarios where it wouldn't present itself as severe and we may have overlooked it for what it is?
Well, Stefan, this is it's called an enteric bacteria. So it's really you eat it, you ingest it, you eat contaminated water or contaminated food or undercooked food, and that's how you get it, or food that's been contaminated, like the pistachios. And really it causes gastroenteritis, so a gastro. So basically it could range from, after a couple of days you've eaten it, your abdominal pain, cramps, diarrhea, vomiting, to severe diarrhea, severe vomiting, to the point where you're dehydrated and need to go to hospital for IV rehydration. So it's a really wide spectrum. And the other problem is that a few other, viruses that are circulating, the gastro bugs that are out there can mimic the same type of symptom. So the bottom line is that if you're experiencing these symptoms that don't go away, or you have a young child that's, continuing to vomit, continuing to have diarrhea, and is showing signs of dehydration, then you need to seek medical attention. Again, I want to stress that not every person that develops vomiting and gastro symptoms has salmonella, but what we look for, regardless of the cause, is any sign of dehydration and not feeling well. Typically, Stefan, the younger a child is, or the older individual is, the more severe the infection would be.
And just quickly before I let you go, because you did mention ingestion, and I want to reassure the public in either direction of your response. So if salmonella, there are some GI or gastrointestinal issues that can be contagious if you're near someone with it. Is that not the case with salmonella?
Well, that's a good point. You are contagious, but really, if you don't wash your hands, let's say, and prepare food, and that person eats that food, it's not like contagious, like you have a flu and one person spreads it to another that way. It's really spread through what we call foodborne. So basically, I have salmonella, for example. I don't wash my hands. I cook. I put my hand on food, and you eat that food or whatever else I've contaminated. That's how you get it. It's not the typical way of transmitting it. So again, that's why we tell people who do have salmonella that they shouldn't prepare food for 2 weeks.
Understood. Dr. Paul Roumeliotis, we always appreciate your time. Take good care.
Thank you.